Question number 5, in McKelvie.
Thank you, Mr. Speaker. My question is to the Minister of Health, and it's not personal. Can he confirm that 30% more hip and knee joint replacements were carried out in 2015-16 compared with 8,439 in 2007 and 8, an increase of 2,573 operations?
Mr. Speaker.
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, yes, I can. This 30% increase is the result of the hard work of clinical staff and the extra $200 million the government has invested into elective surgery over this period. It's a very significant increase in access to these important operations that reduce pain and enable New Zealanders to better get on with their lives. With the growth and ageing of the population, we need to continue to do more, and that is why the government has put in an extra $96 million over 4 years to ensure that more New Zealanders get the surgery that they need.
Supplementary, Mr. Speaker.
Supplementary question in McKelvie.
Given the forecast ageing and growth of the New Zealand population, what is the government doing to specifically address this growing need?
The Honourable Dr. Jonathan Coleman.
Mr. Speaker, firstly, we're delivering more access to specialist assessments in the area of orthopaedics, where the number of first specialist appointments have gone up from 43,251 per year to 53,627. That's an increase of over 10,000 under this government. These are some of the 550,000 patients seen by specialists now each year, which is 1 in 10 New Zealanders every year. We're also focused on intervening at an earlier stage to prevent the need for surgery in the first place, and that's why we've developed mobility action teams made up of GPs, dietitians and physiotherapists, and we're rolling them out across the country to assist New Zealanders with self-management, education, exercise and pain management. These teams are part of the wider government response to the increased demand for surgery.
That's a great question.
Supplementary question, the Honourable Annette King.
Is he dismissing research published in the New Zealand Medical Journal in September, which showed the rate of hip and knee surgeries per 100,000 population was lower in 2013 than in 2007? And isn't this a truer measure of what's happening in New Zealand?
No, it's not a
Coleman.
truer measure of the overall picture. As I said, the numbers of operations have gone up overall, and more New Zealanders are getting more timely access to these procedures all the time.
Point of order, Mr. Speaker.
Point of order, the Honourable Annette.
Mr. Speaker, I seek leave to table the New Zealand Medical Journal research headed equity of publicly funded hip and knee joints. It's not easy to obtain.
Leave is sought to table that particular research document, the Medical Journal. Is there any objection to it being tabled? There is none. It can be tabled.
Question, Mr. Speaker.
Supplementary question, the Honourable Annette King.
Can he confirm the total number of additional elective orthopaedic operations across all DHBs between 2014-15 and 15-16 was only 284, and does this keep up with population growth, let alone the level of pain and disability people face?
Well,
the Honourable Dr. Jonathan Coleman.
Mr. Speaker, I'd have to go away and check the members' figures closely. All I do know is that it's nothing like the 2,000 drop in operations that occurred during her period as Health Minister.
Point of order, Mr. Speaker.
Point of order, the Honourable
Mr. Speaker, I seek leave to table an OIA from the Ministry of Health dated the 8th of September, showing elective surgery discharges 200, as I said, 284.
The document's been described. It's an OIA response. Well, I need to put. Are you seeking leave to table something else
Sorry,
as well?
I wanted to table it.
I'll hear from the other one. I'll put them both together. What's the other document?
I wish to table the 2008-2009 publicly funded hip and knee replacement funded by Labor but counted by National in their operations.
And what's the source of the second document?
It's from the publicly funded Ministry of Health's documents, OIA, Mr. Speaker.
Leave is sought to table an OIA response and a Ministry of Health data information. Is there any objection to either of those two documents being tabled? There is none. They can be tabled. Question number 6.